Hi, this is Dr. Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. So when we have a new patient start care in our office, there is always the question of how many times do they need to be seen and what period of time to be able to get results. Sometimes we're dealing with patients who their problem is just purely musculoskeletal and nothing else. But more often than not, when we're having a patient start with care, the main thing we have to fix first is problems in the nervous system called subluxations. Very simply, a subluxation means a misfiring nerve. There's something our body creates on purpose as a protection against overloads of physical, chemical, and mental stresses. But these misfiring nerves make it to where your brain can't get your body to heal and repair the way that it's supposed to. So this is the first thing that usually needs to be addressed and taken care of. So how often do you need to be adjusted to be able to correct your subluxations? Well, let's make this something that's more familiar to you and more concrete for a moment. Let's talk about changing your muscles with exercise. If you wanted to change your muscles, you know you would have to go to the gym minimally 3 days per week, right? 4 is better, 5 is even better yet, but 3 is the bare minimum that it takes to make any real change happen. Whether your goal is to gain strength, lose weight, increase flexibility, tone up, whatever, you're going to need to go to the gym minimally 3 times per week. Well, that's what it takes to change muscles, which are all in all a relatively simple type of tissue and cell. But what we're talking about changing is misfiring nerves. The nervous system is the most complex type of tissue and cell in the human body. So instead of minimally 3 times per week, to change your nervous system, it takes minimally 4 times per week. So 4 visits per week is the bare minimum that it takes to get things to start changing if your problem is a subluxation or a misfiring nerve. If it's just purely a musculoskeletal problem, well, then 3 times a week is probably going to be enough, possibly even only twice per week. It obviously depends on the particular patient, their particular situation, and what challenges they're dealing with. We're going to look at each patient individually and find out what this particular patient's problem is, where is it stemming from, and whether they need to be seen twice a week, 3 times a week, 4 times a week, and for how long. That's certainly the key to the whole thing there. We do reevaluations every 12 visits so that we can make sure we're monitoring your progress very, very closely. And from there, we'll be able to determine when is the right time to go from 4 times a week to twice a week to once a week, or 3 times a week to twice a week to once a week, or just to go straight from twice a week to once a week, depending on your particular situation and your particular needs. So thanks for your time and attention. We'd love to see what we can do to help you out. And remember that you are always welcome to post any questions or comments below. Thanks again, and Dr. Ranicki with Dr. Ranicki's Creating Wellness Center.